Welcome to today's City Club Forum. My name is Lee Friedman, and I have the privilege of serving as the president of the City Club of Cleveland. For 95 years, and from the heart of downtown Cleveland, Ohio, the City Club has served as one of the nation's premier public podiums for civic dialogue about the most important topics of our day. It is my honor this afternoon to introduce our distinguished guest. Josefina Carbonell was confirmed as the Assistant Secretary for Aging at the U.S. Department of Health and Human Services in 2001. As the longest-serving Assistant Secretary for Aging, she brings strategic vision towards improving the capacity of the community-based aging network. Striving to help older adults live and age with the highest quality of life possible in their communities, Assistant Secretary Carbonell is committed to increasing the health and vitality of America's elders. Under her leadership, the department is improving access to quality care, emphasizing prevention for improved longevity and fostering consumer choice. The President's appointment of the Assistant Secretary followed 30 years of community service in Florida. In 1972, she founded the Little Havana Activities and Nutrition Centers, leading it to become one of the largest Hispanic community-based care organizations in the nation. As the agency's president, she organized Rainbow, a child care program staffed by Little Havana's elderly. Affecting the lives of 8,000 Miamians, Assistant Secretary Carbonell organized support for legislation focused on Florida's children, elderly, and disabled. She has launched several health and social initiatives, including a pilot clinic for older adults and their families, as well as implementing a national emergency program for Florida's volunteer health professionals. Her leadership capabilities are clearly evident. Even in a time of crisis, she helped deliver meals and water to elders isolated by flooding during Hurricane Irene. A native of Cuba, Assistant Secretary Carbonell was selected as 2007's Outstanding American by Choice and was also named one of Hispanic Business's 100 Most Influential Hispanics in 2001. She attended Florida International University and was recipient of the Kellogg Fellowship in the Health Management at Harvard. Please join me in welcoming to our podium Assistant Secretary for Aging at the U.S. Department of Health and Human Services, Josefina Carbonell.
Thank you. Thank you, Lee. Good afternoon, and thank you for your warm introduction. As I was coming to speak to you all, I was much impressed with the history behind the City Club. And, of course, the wonderful history that the city has provided, just an incredible platform for presidents, for policymakers, and visionaries from across the world. So I am honored to be here in their company and in your company. Our nation has arrived at a critical juncture in history. As the baby boomers age and America's older population grows larger and more diverse, our country faces real challenges, but great opportunities for the future. The one closest to my heart, and my topic for today, is long-term care. At its core, this issue is how we, individually and collectively, and as a nation, will care for our loved ones as we age. The older population of yesterday, the greatest generation, made enormous gains in health and financial security. Preserving these gains for the next generation of elders will require discipline, planning, and action. The age wave has arrived, and it's time to act. Every 5 minutes in the United States, 23 adults are turning 65. And by the year 2030, that number will double. Within 10 years, almost 50 million Americans will be over the age of 65. And for the first time in our history, not only in the United States, but globally, the elderly will outnumber children under age 5. These numbers present us with the tremendous challenges as well as opportunities. First, I'd like to talk about the challenges. Today, nearly 16 million older Americans live with chronic conditions that limit their ability to carry out the activities of daily life, such as grocery shopping, cleaning the house, preparing meals, getting in and out of bed, and bathing. About 5 million seniors are severely impaired and depend on assistance from others for their well-being. We don't have a long-term care system in this country. We have a hodgepodge of programs and supports. Families are the primary providers of long-term care. They provide over 80% of all the long-term care in this country and comprise the largest segment of our caregiver workforce. Paid care, both provided professionally and by professionals and paraprofessionals, are also a crucial part of the equation, but it can be expensive. On average, an individual over the age of 65 can expect to spend nearly $50,000 on their long-term care. And 16% of that population can expect to spend more than $100,000. Unfortunately, our current system is biased towards costly nursing home care, which most people cannot afford. In Ohio, a one-year stay in a semi-private room in a nursing home costs over $60,000. Institutional care is an essential part of long-term care, and it will always be the best option for many people, but it should not be the only option. The system of care that we have today is not the result of any coherent set of policy choices. It really became about largely by default. When Medicare and Medicaid were enacted in 1965, Medicare, our health care insurance program for the elderly and disabled, covered acute care, not long-term care. Medicaid, originally designed to be the health care safety net for the poorest and neediest, did include a long-term care benefit in the form of nursing home care. And it actually evolved in a de facto fashion to become the main payer of long-term care. As a result, we ended up with a public policy that said, if you need to pay for long-term care, you're on your own. Until, of course, you impoverish yourself through nursing home care. Then, when you're poor and in a nursing home, the U.S. taxpayers will foot the bill through Medicaid. The system we have today isn't cheap, and it's not liked by seniors and younger people with disabilities who overwhelmingly prefer to receive their care at home. As a nation, we're spending more than $200 billion a year on long-term care, and nearly 60% of these dollars go to nursing home care. When we look below the national figures, we find that 30 states are spending 75% or more of their Medicaid long-term care budgets on nursing home care, and a dozen of these states are actually spending more than 85% on this form of care. Despite its high cost, Americans are not aware of the vulnerability to long-term care. Most people incorrectly think Medicare pays for long-term care. And when they do need help, which usually happens in a time of crisis, they can be overwhelmed by a confusing maze of agencies and bureaucratic requirements. This hinders informed decision-making and often results in the use of care that is more intensive and more expensive than necessary. The future of long-term care is as much about helping our citizens to make informed decisions about the care that they pay for as it is about redirecting the use of the public funds. For far too long, we have forced our citizens to lose their connections to the community, spend all their savings, and become totally dependent on Medicaid, a public program. All these challenges create an opportunity for reform, and while long-term care is clearly tied to the larger issue of health care, we don't need to stand still while the important national debate on health care reform continues in the months and years to come.